This is a medical horary. It is part of a large advanced course on horary astrology for professional astrologers. The current asks the following. She has noticed a symptom. Every time she sits down and crosses her legs, her right leg, from the knee and downward, swells. The question is, what causes this swelling? What makes this horary difficult? Unlike most medical horaries, where the question is what to do with the symptom, where we can identify the excessive humor or the planet of illness, and then speak in terms of litho or phytotherapy, here the querent is interested in the symptomatic cause of the swelling. In other words, our task as astrologers is to conduct a kind of diagnostic analysis, similar to what neurologists would do, to identify dysfunction in the body or some other organ or function that is connected to the swelling. The second difficulty is that the current herself, the moon, is a cold and moist planet which is located in a cold and moist sign. We have no elemental imbalance between the planet and the sign it occupies, and therefore we cannot formally take the dispositor of an incompatible element, for instance Mars, and analyze it. In this case, we need the help of the software. We go to the section Naturopathy, Symptoms, and choose the first house for the body of the patient. It is selected by default, and the program performs a preliminary analysis. It says there are two planets likely to be candidates for the illness: Jupiter, because it is angular and the most elevated, and the significator of the patient, the Moon. Since Jupiter appears twice in this list, it is more likely to be the significator of disease. To confirm this, we only need to check whether Jupiter corresponds to the knees and feet. If these body parts are mentioned at least twice, that confirms Jupiter as the significator of disease. We open the list and see that Jupiter indeed indicates the knees and feet, and it also naturally rules swelling. So Jupiter clearly repeats what the current describes. Here comes the main challenge of this horary. If we were to interpret Jupiter in the traditional way, we would say that the phlegm is in excess in this horary, and we would then suggest remedies aimed at reducing this humor. But we can't just tell the current, you have an excess of phlegm and that's why your leg swells. That is not what she's asking for. So we also cannot simply state that Jupiter rules the 10th house, which correspond to the knees, and that the illness is located in the knees just because we already know the swelling is in that area. However, Jupiter also has another natural meaning. It represents blood, and in this chart it is stationary. This may be significant. Blood that is not moving, a stagnation of blood, can cause swelling. Yet blood stagnation itself is not the root cause. Blood stops moving because of something else. The mistake many astrologers make is that they start looking for the aspects that Jupiter casts to different parts of the chart, trying to see what it affects. But this is the wrong approach. We need to do the opposite. Look for the other planets that might represent various organs or functions of the body that cast aspect to Jupiter from their own places. That would literally show that certain bodily functions or organs are influencing the swelling of the knee and the stagnation of the blood indicated by Jupiter. Looking at the chart, we see that the only planet casting close aspect to Jupiter is Mars. Following Lily's method, we might consider an orb of 3 degrees, but according to Morinus' method, we use astronomical orbs, and Mars's orb is much larger than 3 degrees. Within its orb, Mars does indeed affect Jupiter. It is the only planet connected to Jupiter, hence to the swelling and blood stagnation. Mars is extremely slow in this chart, moving at less than 50% of its average speed. Therefore, we say it is sluggish. Now let's look at what Mars naturally signifies. Mars represents the muscles. Immediately we notice a meaningful intersection. Mars, sluggish muscles, and Jupiter, blood stagnation. Reduced muscles mobility contributes to poor circulation and swelling in the knee. The chart through different planets is describing the same condition. We are seeing a picture of a muscle spasm causing a blood stagnation. But notice that Mars operates against the backdrop of Mercury. Mercury naturally rules the nervous tissue and all the conducting fibers in the body. What is Mercury's state? It is debilitated in the place of its exile. Moreover, Mercury itself acts against the backdrop of Jupiter. But we can say that the damaged nervous tissue manifests against the background of swelling. Rather, it is the opposite. So we must find another explanation for this disposition. Jupiter rules the ninth house in this chart, which corresponds to the thighs and buttocks. Therefore, we can say that Mercury's debility indicates compressed nerve in that area, the area of thighs and buttocks. Putting it all together, a muscle spasm causes blood stagnation and also compresses a nerve in the region of thighs and buttocks. This in turn leads to the swelling of the knee and lower leg. And now the resolution. The current went to a doctor, a neurologist. The examination confirmed that the swelling was indeed caused by the spasm in the right gluteal region. The spasm pinched a nerve, which reduced blood flow. As a result, the punched nerve and poor circulation led to the swelling. So everything turned out exactly as shown in this Horary chart. Interestingly, this analysis went beyond William Leland's standard techniques and applied the methods of Morinus.